Welcome to this explainer. Today, we're going to decode the medical reality of scabies, translating clinical dermatology into a straight-up battle plan. We're going to look at the fascinating and honestly pretty startling science of what happens when the human body becomes a host and exactly how we can fight back. So let's dive right in with a simple question. What exactly is living just beneath your skin to cause that intense, relentless discomfort, especially right in the middle of the night? It's a condition that has plagued humanity for centuries, but the microscopic reality of it is something most of us never get to see. Here's our intelligence briefing for today. 1. The microscopic invader. 2. Symptoms and telltale signs. 3. Complications and lookalikes. 4. The counterattack with treatment. And 5. Stopping the spread. Starting with Section 1, the microscopic invader. Meet Sarcoptes scabiei hominis. To really understand how stealthy this invader is, you have to look at the scale. The adult female mite, the one actually responsible for the infection, measures a mere 400 micrometers. That makes her practically invisible to the naked eye. She thrives by burrowing directly into the outermost layer of your skin, the epidermis, and setting up a totally hidden tunnel system. And once she's successfully burrowed in, this microscopic invader has a life cycle of about 30 days. Here's the kicker, though. She spends that entire month living completely inside your skin, just feeding and preparing to multiply. Every single day within that tunnel, she lays 2 to 3 eggs. Those eggs hatch in a matter of days. The new mites mature rapidly, and they quickly expand their hidden numbers right under the surface. Now, here is a fact that absolutely blew my mind. With all that agonizing full-body itching, you'd naturally think you're crawling with thousands of these bugs, right? Well, clinical data shows a typical host carries a shockingly small army of only 10 to 15 adult mites at any given time. That's it. Just a dozen or so mites is all it takes to throw your entire immune system into total chaos. Moving to Section 2, symptoms and telltale signs. The infiltration and the body's alarm. The timeline of the body's hypersensitivity here is wild. During a first infection, your immune system is entirely naive. It literally takes a painstakingly long 2 to 6 weeks for your body to even recognize the invader and for the itching to finally begin. But if you catch it again, your body remembers. It mounts an immediate, intensely itchy defense in just 24 to 48 hours. But itching isn't the only clue. We also have definitive visual proof of the mite's pathway. The classic scabies burrow looks like a tiny, elevated, grayish-white thread under the skin. Usually, it's just a few millimeters long, but it can reach up to 15 millimeters. That line is the actual physical tunnel where the female mite lives and lays her eggs. And these mites have very specific preferences for where they set up camp. They target thin-skinned, warm areas. The most common battlegrounds include the webs between your fingers, the front folds of your wrists, armpits, around the belly button, and the genital area. Weirdly enough, they almost always spare the face and scalp in adults, but they can absolutely show up there in infants and young children. All right, Section 3, complications and lookalikes, the collateral damage. That relentless scratching isn't just uncomfortable, it can lead to real severe collateral damage. We see eczematization, where the skin gets red and inflamed from scratching or reacting to harsh meds. Then there's lichenification, where chronic scratching turns the skin thick and leathery. But the most concerning is bacterial superinfection. When you break the skin, bacteria gets in, creating painful pustules. In severe cases, those bacterial infections can even trigger acute glomerulonephritis, which is a really serious inflammation of the kidneys. And then we have the worst-case scenario. When the immune system is compromised, like in the elderly, people with HIV, or organ transplant recipients, we see a variant called Norwegian scabies or crusted scabies. In this terrifying scenario, instead of the usual 10 to 15 mites, the host skin is swarming with up to 1 million mites. It creates these thick, highly contagious crusts and requires immediate aggressive medical intervention. Section 4, the counterattack. Our weapons of eradication. Let's compare our topical artillery. Permethrin 5% cream is widely considered the gold standard. It's highly effective and generally very safe, though it might cause some temporary mild itching. On the other hand, Lindane 1% is effective, but comes with a massive warning label. It's neurotoxic and strictly forbidden for pregnant women, nursing mothers, and young children. Finally, you've got sulfur ointments. They are very safe for infants and pregnant women, But let's be honest, they smell terrible and will definitely stain your clothes.
But having the right medication isn't enough. Execution is everything. You have to follow a precise eradication protocol. First, wash and dry your skin completely. Then apply the medication in the evening from the neck down, covering every single inch of your body, paying special attention to those folds and crevices we talked about. Leave it on overnight for 8 to 12 hours to let it do its lethal work, and then wash it completely off the next morning.
Finally, Section 5, stopping the spread, securing the perimeter.
The good news here is that the scabies mite is highly dependent on us. It dies quite quickly, usually within just 3 to 4 days when it's away from a human host. Because of this, meticulously washing all recently worn clothes, towels, and bedding in hot water at 60 degrees Celsius will kill them. For things you can't wash, seal them tightly in plastic bags for 10 days to guarantee the environment is safe. And this is crucial. Every single person in the household and all close contacts must be treated at the exact same time, whether they are itching or not. Otherwise, you're just going to pass the mites back and forth. To wrap up this explainer, I want to leave you with this thought. We've looked under the microscope, we've mapped out the enemy's 30-day playbook, and we have detailed our clinical counterattack. But given that it takes up to 6 weeks for symptoms to even show up during a first infection, are we truly paying enough attention to our skin to recognize this ancient invader before it spreads to those closest to us? Knowing these telltale signs and understanding the actual science of the itch is your absolute best defense to stop the spread before the invasion even takes hold. Keep this knowledge in your back pocket and, as always, stay curious.